Hi guys, let's see the review of Nelson textbook of Pediatrics volume number 2, edition 21st, international edition. Here are the authors. Then there are a lot of contributors are there. In this volume number 2. In this video, I will discuss from the top urological disorders in infants and children, gynecologic problems of childhood, endocrine system, nervous system, neuromuscular disorders. First, let's see the urological disorders in infants and children, congenital anomalies and dysgenesis of the kidney. The main embryology and fetal development is given. Then about Sinner syndrome, the stillborn infant with the renal agencies. Diagram is shown. Then horseshoe kidney is shown in the figure. Then UTI, urinary tract infection. Then intrarenal reflex radiological findings. Then about vesico-urethral reflex, main classification, vesico-urethral reflex showing grade 4 of vesico-urethral reflex. Then about obstruction of the urinary tract. Enuresis and voiding dysfunction. Here the spinning top deformity, voiding cystourethrogram. Here that is labile adhesion. Note the inability to visualize the urethral meatus and vagina. And anomalies of penis and urethra. Here the varying forms of hypospadias is given in the picture. Then the two examples of chlorida of hypospadias. Then paraphimosis. This balanitis erotica obliterans. Then about penile torsion, etc. Then here the disorders and anomalies of scrotal contents. The main flowchart is given. Then about trauma to genitourinary tract. Then urinary lithiasis. Then vulvovaginitis. The main causes, epidemiology, clinical manifestation, differential diagnosis. Then about the flowchart of management of lichen sclerosis. Vaginal bleeding in pre-pubertal child. And about breast cancers. The main preoperative frontal view is given here. Then PCOS, polycystic ovary syndrome, and hirsutism. Here the main hormonal contraceptions, anti-androgens, metformin. Then gynecological neoplasm and adolescent prevention methods for human papillomavirus. The main tabular column. Then vulvovaginal and Mullerian anomalies. Then about other anomalies of arginine vasopressin metabolism and action. Then hyperpituitarism, tall stature and overgrowth syndrome. Here is the diagram of cerebral gigantism. Then about congenital hypothyroidism in infants of 6 months of age. Then thyroiditis, goiter, thyrotoxicosis. Then about pseudo-hypoparathyroidism. Then about adrenocortical insufficiency. Then congenital adrenal hyperplasia and related disorders. The main congenital adrenal hyperplasia of 6-year-old girl with etiology, epidemiology, genetics, pathogenesis is given. Then about pheochromocytoma. The main bilateral pheochromocytoma of 11-year-old boy. Hypofunction of the test. Then about gynecomastia, hypofunction of ovaries. Then diabetes mellitus, classification of diabetes mellitus. The main type 1, type 2 diabetes mellitus. This is a closed loop system of T1 diabetes mellitus, artificial pancreas. Then about nervous system, neurological evolution, the main history and neurological examination like mental stature, head, etc. The main screening scheme of developmental delay and upper range. The main 12 cranial nerves is given in detailed manner, like first olfactory, optic, oculomotor, trigeminal, all those nerves are given here. Then about the normal tone in full term neonates. Then how the flexed resting posture are given. Then opisthonous in the brain injured infant. And about congenital anomalies of central nervous system. Then about spina bifida occulta. Here the clinical aspects of congenital median lumbosacral cutaneous lesions. Then about microcephaly, the main causes, pathogenesis, clinical manifestation. Then seizures, that is febrile seizures. Mechanism of seizures is given, generalized motor seizures, myoclonic seizures, the main etiology. Then about conditions that mimic seizures. Then about Stouch-Weber syndrome is given, the port wine stain involving both V1 and V2 dermatomes. Then myoclonus. In each and every chapter, the detailed explanation of table column is given. The syndromes of dystonia. Neurodegenerative disorders of childhood, that is sphingolipidosis. The main degradation pathway of sphingolipid is given clearly in a detailed manner. Then about pediatric stroke, main arterial ischemic stroke is. Then about arterial ischemic stroke, the main 3-year-old boy has a sudden onset of left-sided weakness. Then about central nervous system infection. Here the examples of different triggers of rhabdomyolysis given in the flowchart. Then about developmental disorders of muscles, myofibril myopathies. Then about endocrine and toxic myopathies. Here the table column of hereditary peripheral neuropathies is given in the tablet column. Here about leukodystrophies, Guillain-Barré syndrome, the main causes, pathogenesis, etiology, etc. is given. Then Bell palsy. Then about disorders of eye. Disorders of eye, the main growth and development of the eye. The main examination of the eye is given. Then like color vision testing, visual acuity, binocular vision. Then abnormalities of refraction and accommodation. Then disorders of vision is given. Here like diplopia, suppression, Then anomalies of pupil and iris. The flowchart is given clearly. The approach of onychosuria. Then about congenital esotropia. The flowchart of infant of more than 4 months of age with esotropia. Then about abnormalities of lids. Here the Marcus Gun jaw winging phenomena is given. Then epiblimoprophen. Then disorders of the lacrimal system. Here the picture of lacrimal apparatus is given. Then about abnormalities of the cornea. Here in each and every chapter, the main diagrammatic representation of herpes simplex corneal epithelial keratitis is given. Then about disorders of the uval tract. Here the disorders of the retina and vitreous. Here the progression of retinoblastoma. Here the tumors are given. Then about abnormalities of the optic nerve like optic aplasia, hypoplasia. Then childhood glaucoma. In child the increased intraocular pressure. Then about orbital infections like orbital anomalies. Then injuries of eye like echemococcus and swelling of the eyelids. It is the injured eye. Then about eyelid echemococcus and subconjunctival hemorrhage. These are the diagrammatic representation. Then about here the child abuse and the fireworks related to the injuries. Then about handheld laser retinal injuries given. Here the laser damage of left eye is given here. That's all. Thank you.